Are you tired, angry, irritable if you skip a meal? Do you wake up 2 or 3 in the morning and can't go back to sleep? Well, your blood sugar may be crashing. So today we're going to talk about hypoglycemia, and we're going to define the 3 mechanisms. Hypoglycemia pathological. This is when your fasting glucose will be below 65 in the morning. Sometimes it'll be in the 40s. This is usually caused by some sort of disease process or exogenous insulin. So diabetics will often go into a pathological hypoglycemia when they do their injections, but they're not eating enough to sustain their blood sugar levels. Medications like metformin, etc., can also cause this pathological fasting glucose to drop below 65. Hypoglycemia, functional. This is fasting glucose below 85, and you'll have another marker called LDH, or lactate dehydrogenase, and that will be below 140. That could be indicative of hypoglycemia. Symptoms are unrelated to any type of disease or medication, and symptoms are resolved when you eat. So as soon as you eat, 10 to 15 minutes later, you're like, "Ooh, I feel so much better." There's another one called hypoglycemia reactive, right? You eat, and within 2 to 3 hours of eating, your blood sugar will drop. So this is where you eat, let's say, something sugary, like pasta or some sort of like a bread or sandwich, or etc. Right? You're going to have a spike in glucose followed by a spike in insulin. And once that happens, glucose will drop and crash very quickly for these individuals. So 2 to 4 hours after you eat, you get shaky, irritable, angry, and you need to eat again. So the typical patient who has hypoglycemia like this are usually women. They're thin, they have low blood pressure and low cortisol. So they have a hard time getting up in the morning. They drink a large cup of coffee with extra cream, extra sugar. They get their energy. Just before lunch, they're famished. They get a little irritable. I gotta eat. So they eat something sugary, right? And a sugary drink around lunchtime. They have that, they feel a little better, and around 3 or 4, they're crashing again. So they get this up and down of sugar throughout the day, followed by insulin. And whenever you have these spikes and lows, you are causing inflammation. So a lot of these patients will have, they look fine when you just look at them, but they have low energy, low blood pressure, and low glucose level, and they're always tired. Their mood goes up and down, their energy goes up and down, and they just don't feel well, okay? So those are the 3 types. In my next video, we're going to go ahead and discuss all the symptoms and some of the causes for hypoglycemia. But if you would like a cheat sheet on all the symptoms related to low blood sugar and high blood sugar, click on the link below. It's my free community where you can go ahead and download all the symptoms related to blood sugar dysregulation.